Thank you, James. It's a pleasure to be on here with you guys. I want to say send a couple of shout outs. I see a few people on here that I'm friends with, my colleagues. Melvin Smith, who's been one of my, he's been a rock for me since I started this journey with our department and helping me understand how the behavioral health care system tied into different parts of state government. Some of my team, Dustin Ritchie and Nathan Payne, both regional overdose prevention specialists, Project Lifeline specialists, and our collegiate recovery coordinator, which all evolved and are the progeny of our faith-based initiative, which is going to be an awesome story to tell. My good friend Dawn Tyus, who I met many, many years ago, and she and I have all been colleagues for some time. I appreciate her. Jennifer Witt from Kentucky. Met Jennifer through another conference, and Jennifer, thank you for coming on. And lastly, but firstly, Miss Pamela Lee. Pamela and I have presented together, been together, connected together, and conversated over the last few years. I'm very, very thankful. If it's anybody that I missed, there's a lot of people on here, so my screen only holds so many people. But it's an honor. It's an honor to be here. Maria, did I say you? Maria Smith from Tatus. I see you, Maria. Maria's also been a good friend of mine. Maria keeps me in line. If you don't know Maria from Tatus in Tennessee, Maria, I'm going to say this is as cool and as Southern as possible. She don't take no junk off us, fellas. When she needs something done, Maria gets it done, and you're going to do it, and she's going to help you do it in its proper context, fashion, and within its time frames. Maria, that's a nice way of saying that I love you, I appreciate you, and I'm thankful for all that you've ever done, and thank you for those extra pushes that you've given me and my team and those extra resources. But again, I am so thankful to be on here today. And before I share my screen, I like to kind of give everybody a little bit about my background. To kind of let you know who I am. First, I just started wearing glasses during COVID. I got this unique thing that happened to me from staring at the computer every single day. My eyes started to, do its own thing. So now I've got glasses, so I think I look more studious, Melvin. I've clicked in pretty well. I'm engaging in the glasses wearing. It's a new thing to me. I usually forget them, but today I can't because we're going to be on here for a little time. But moreover, I want to talk about me personally and my journey into this position. My name is Monty Burks, and I'm a person that's in long-term recovery from substance abuse and a significant mental health diagnosis. I've got 21 years. March 3rd, I celebrated 21 years free from addiction, free from the bondage that almost destroyed me and my family and every single thing that I could touch. And, I don't mind telling my story. The reason that I don't mind telling my story is because 21 years ago, I couldn't tell my story. If I did, the people that I needed to help me were already locked in a seat of judgment against me because they had a preconceived notion of who I was and what community I came from, even though that necessarily wasn't me, or it might have been them. We have allowed stigma for years to control how we treat our neighbor, not allowing us to take an opportunity to understand that the person beside us, while they may be different, they're not that different. Sometimes circumstances and situations take things away from people or put people in spots that they're not able to control. Sometimes we make choices that we don't understand the full impact or the long-term ramifications of those choices. I was one. I come from a very rural southern town on the tip of Alabama and Tennessee. I am a Tennessee football fan. I did not go for Alabama. I like Alabama. They win a lot of football games, but my Vols will eventually win a lot of football games. And I'm going to continue to say that as long as I can until hopefully we win some football games. But I'm a UT fan. I'm from Winchester, Tennessee. I'm from, where a couple of our head coaches were from. I grew up in a really unique family. My mother is a missionary evangelist. She played the piano. She's from the Kojic denomination. She's played the piano since she was 4 years old. And I grew up very uniquely structured within the faith community. And I'll explain to you, if anybody knows where I'm from and they visited this area, they'll get this. In the town that I'm from, there is a church or faith-based something just about everywhere you look, in every direction you look when you come into the town area. And even as you go into the rural parts, you still see houses of worship. Just about every mile or so, you find a steeple or something, some type of house of worship. In those small towns, everybody knows everybody. So faith communities are connected. We may worship different on a Sunday or on a Saturday or whatever that other day we choose to worship. But on those days, on the other days, we still all know each other. We share common threads and common bonds. And a lot of that is community connection. I grew up in a town, an area in town called Churchtown. And that area was shaped like a horseshoe. So on my street, there's a reason that I'm telling you guys this because I need you to understand the significance and the power of the faith community when they can put priority and practice together for purpose to save someone's life. The area that I grew up in, I went to church at this church, and there was a church here and a church here in a horseshoe. We called it Churchtown. And I can remember on Sundays, everybody went their own way. But after that, the other 6 days during the week, everybody kind of commingled. The cool thing about that was in those communities, everyone knew everyone. So if you got in trouble on one street, the word would, we didn't have text messages or cell phones back in the day, but the word would reach your mama's house before you got home that you've done something. And that type of collective efficacy, social organization in a community has been something that saves so many people's lives. And it's also something that we need to look at when we start talking about addiction and mental health issues. Addiction is the equivalent of isolation. That's what happens. It separates people from things they need because obviously it's something that's unhealthy for them. But sometimes people get into the shame and guilt version portion of that, and they don't want to talk to people. But I can remember somebody else's grandmother getting on to me and calling me by my grandfather's name. And she didn't know my name, but she knew who I came from. And she straightened me out, sent me home. And I was like, wow, how did she know who I was? You know, how did this lady address me like that? And I'll tell you one thing I did do is even though I didn't know her, I listened to every word she said. She spoke to me in a way that I could understand and sent me on my way. You see, the power in the faith community is there. It's been there. People connected at the root, from the root out in these communities has been there for so long. And we need to make sure that we pull the faith community back into the conversations around behavioral health. We start talking about substance abuse and mental health, the faith community has to be involved in the equation. Now, listen, everybody does not have a faith tradition. Everybody doesn't believe in a deity. Fair enough. I'm not asking everybody to believe in anything. I don't care if you don't believe in anything. What I do know is who I am and what I've been through. And the church was part of my healing process. I know that because of the recovery walk that I had to walk, that I can help other people find those places of safety, of comfort, and they can transition and go out and help other people. You see, when I fell from grace, these are my words about me. This is about nobody else. This is about me. But in my mind, when I fell from grace, it was my third year in college. My father passed away. And when my father passed away, I took a deep dive into drug use. A college kid, father removed from the picture, introduced to a new world. I left small town, went to me, I went to the big city, to what you guys would probably consider just another pond, right, close to a lake. I moved to the big city, Middle Tennessee. And when I went there, I had left that structured environment, all those churches where I knew everybody, my mother, the missionary evangelist, all the community ties. My family's in education. Some of my family's in law enforcement. Well, guess what? They weren't there anymore. I was away from them about 90 miles so I could live freely and do whatever I wanted. So when the stress and anxiety hit me of the loss of a loved one, the grief of losing a loved one, I looked for something to fill the void, and I found it. I found it through certain friends who introduced me to lifestyles that I wasn't necessarily ready to ready. Nobody's ever ready for that. But they introduced me to club drugs. Cut 2 to 3 years later, I was a full-blown functioning drug addict. I'd been kicked out of school. I was suspended from school. Back in those days, they used to suspend us from school for not attending class and then failing the semester. Now we have unique policies that try to pull the children back. And if you guys don't understand how that works, let me explain something to you. Sometimes when a child doesn't come to class, sometimes, not always, but sometimes there are other reasons why they're not there. It's not always because they don't want to come. It could be some social conditioning that's going on. It could be some removal of a parent. It could be some responsibilities that a 9, 10, 12, 13, 14, or 15-year-old should not have, but they do have. So maybe sometimes what we consider something good for them is usurped by something that they have to do, like feed a brother or sister or take care of a parent that's an active drug user. But I had become a full-blown functioning drug user, and I was homeless. Man, I got the story for you, man. And it fits so many other people like myself. I was sleeping in the back seat of my car. I was ashamed to tell people that I'd lost everything. And again, here's that stigma. I did not realize that I was in the seat that needed help. And I could not fathom that I was the exact person that I was already judging myself. I was like, man, I ain't one of those people. That ain't me. Ain't nothing wrong with me. I'm having fun. I just hit a bad spot. I ran into a couple of people, a couple of ladies, one lady in particular, And she ushered me into a recovery meeting. It was the first time I didn't know what the meeting was. She asked me to attend a meeting with her. And if anybody remembers late 90s, early 2000s, we didn't call it recovery meetings. We just said meeting, group. We just meeting a group. Super closed off on how we communicated it because people in the community were on the NIMBY. NIMBY is a big thing, not in my backyard. Even for recovery meetings, 12-step meetings and resources that can help people. There are a lot of people that don't want it in their backyard, even though they probably benefited from it at some point in their life. And even though it's probably their children or their mother or father that have made them be so rejectful of a resource that helped them or somebody else. But she introduced me to a meeting. I told her when she told me that she wanted me to go to the meeting, I told her that no. My answer to her was no. She said, her words to me, she said, baby, you need to go to a meeting. She randomly walked up to me in a restaurant and told me that I needed to go to a meeting. Now, I'm a Southern male. I was raised as a Southern male. So my first response to her was, what are you talking about? No, I don't. Because I assumed that she thought something was weak or vulnerable about me. And in the South, and the Southern males as we are, we've been taught that you don't express emotion if you are weak. If you do express emotion, you're weak. If you cry, you're weak. That's something that's a cultural thing that we're slowly gravitating out of. Listen, you can cry in front of me, I'll cry with you. But then I couldn't show her that I was vulnerable. I didn't want to be considered weak. So I told her no. Now, all of you ladies on here, I see y'all shaking y'all's heads, and it's in a good way. I love this. This lady that introduced me to this recovery meeting, she was one of the two ladies that sit on one of the front two pews at any church that you would go to on any Sunday morning in the South. So y'all know her facial expression and her body language when I told her no. Y'all know what happened, right? I know she gave me that extra look, this one right here. So she said, you're going to go to a meeting. And then I went to the meeting. I told her no once. The second time I was in the front seat of a car. She drove me to my first 12-step meeting. Now, we didn't call it 12-step meeting. It's a fellowship that I'm not part of, so I'm not going to name the fellowship. I respect all fellowships, AA, NA, Celebrate Recovery, Narcotic, Nar-Anon, Al-Anon, everything. You guys are wonderful. She took me into a meeting, and it was the first opportunity for me to see that I was not alone, that there were other people like me. But still, when I walked in the meeting and saw the other people, I still rejected them internally because I still didn't feel like I belonged. I still didn't feel like I was one of them. So a guy scooted a chair up and said, sit down. I sat down and I listened. And by the end of the meeting, I was broken. It had broken inside of the layer because I had never had been around people that openly said, I'm a drug user. I'm an alcoholic. I'm an addict. I've hurt my family. I never heard those things. And this was in the back of a church that I'd seen 1,000 times, and I had no idea that meeting was there. I had no clue. Now, that meeting was an open opportunity for me to go to an extra resource. I needed to go to treatment. I ended up going to treatment. I was given an opportunity through the criminal justice system. You guys can figure that out. I've been in trouble quite a few times. The criminal justice system said, hey, you want to go to treatment? You want to go to prison? I said, well, I made a real quick and easy choice and segued toward going into a treatment program. And I got 9 months of residential evidence-based addiction treatment. Everybody doesn't get that. Everybody doesn't have access to that. I was granted that gift. I was blessed with that gift from getting in trouble over and over and over again. But what happened in that process was I was able to reacclimate, better understand, given tools to build my own recovery walk. They didn't tell me how to do it. They gave me tools and showed me how it could be done. They didn't make me do anything. They gave me tools and said, here you go, you build it. These are the things that you know are going to bother you. Here's where it starts. So what happened is after 9 months and 1 day, I was back out in the community like so many people are with a fresh set of wheels, and I needed community. So where was the first place I went back to? That same church. And that same church still had a recovery meeting. They had a recovery ministry. They didn't call it a recovery ministry. It was just a ministry. But I became part of a community. I didn't have to go out to my same playground and playmates that I used to be with. I was able to go to some people that accepted me, embraced me, walked with me on my journey, met me where I was at, and helped me stay clean. That was 21 years ago that I walked out and went into that church. And here I am now. If it wasn't for that lady confronting me, now, she didn't confront me with a fight. I'm going to tell you what she did. I come from the Christian tradition. That's where I was raised. She spoke to me from my tradition, and her words went right straight through me to my heart because I could understand what she was saying. She spoke to me in a language that 3 grandmothers ago had spoke to their grandchildren, and my grandmother had spoke to me, and my mother had spoke to me. She understood that connection was what it took for me for that split moment to take the mud out of my ears and the dirt off my eyes just for a minute for me to go into a program. So, how and why is this important with faith based work? Because you, of all faith traditions, have a unique and significant opportunity to connect with people from your tradition, from your belief, and from your denomination. No matter what I say to you today, I'm going to give you some tools, give you a process that we use, and I'm going to share some tools with you. But no matter what I say, culturally competent mission comes from you. The cultural competency of talking to the person that comes in the pews of your sanctuary is going to come from you, not me. It doesn't come from me. So that means that I'm going to be able to give you some tools, become your partner, become your ally, become your advocate, become your cheerleader, whatever you need me to do. I'm going to give you those tools, tell you how we did it, and hopefully you can build your plane on the runway just like we did. Because we dove in knee deep in the middle of the opioid epidemic, and we had no choice. And if the churches did not step up, if the faith-based groups did not step up, we would have lost countless other lives in our state and around the rest of this country. So right now, that's me. I like to get on my soapbox. My friends on here that have heard me present before, I'm not holding nothing back. I'll be vulnerable. I suffered from addiction. I was a radical in addiction. I'm going to be a radical in recovery. I was loud while I was out there using. I'm going to be loud while I'm clean. Okay. And I hope that I don't offend anybody by telling it like that, but it is what it is. I suffer from clinical depression. Guess what? I no longer have that thorn in my side. I know that it's there, but I have community now. I have a toolkit and I have resources. So when I feel that way, I can call Melvin and say, "What's up, man? What are you doing?" Melvin can give me a free, he's not a therapist or a doctor, but he gives me a free therapy session when I'm about to walk off a cliff. And I've always appreciated him for that. And I've got other friends that do the same thing. That's the power in community. Don't get it twisted, y'all. Sometimes Zoom might be all we got, but you know what? If you reach out and check on somebody that's hurting, you might find out that they might tell you something and where you can help them. You might have a resource to help them. Now I'm going to share my PowerPoint. We're going to get into it. I had to get that off my chest so you can know that I'm not just somebody that works in state government that's trying to tell you how to do your business. It ain't like that. I'm a person that's in recovery. I have been at the bottom. And I also realized that every time I thought I was at the bottom, I met somebody that was beneath the bottom. And they needed help just like I did. So now we're going to go into my awesome, you have to able me, James, give me a, are you ready? It's saying the host disabled participant screen sharing. Is that you or Pam or you, James? There we go. Got it. Okay, so today I'm going to present, I work for the Tennessee Department of Mental Health and Substance Abuse Services in the state of Tennessee. I know it's a long title, TDMHSAS. It actually took me, I've been there for almost 8 years. It took me 7.5 to be able to say it all in one breath without almost totally passing out. But I work for the Office of Faith-Based Initiatives. I'm the director of Faith-Based Initiatives for the department. Today, we're going to talk about priority to practice, a faith and recovery journey. Here's my picture and my contact information. As you can see, during COVID, I've gained glasses and gray hair. This all happened over the course of a year and some change. But here's my contact information. I like to share it up front and at the end. If you guys want to reach out and conversate with me, or you can also reach out to ATTC. They have all of my information. Dawn, Pam, and James can reach out to me at any point. So let me give you a historical overview of our faith-based initiative to kind of let you guys know where we started and how we started. And I was part of the original drive for our department's faith-based initiative because of my awesome and wonderful commissioner, Marie Williams. But this initiative began in 2014 under then Deputy Commissioner Marie Williams and Commissioner Doug Barney. They had talked for years about what an opportunity would be to leverage the faith community to become part of behavioral health, people struggling with addiction. And then they heard me speak at a community function. I've always been an advocate for people that have been broken. I've never held my punches. I've never shut my mouth. I told you guys earlier that I was a loudmouth in my addiction. So I'm going to be a loudmouth in my recovery. I gave up my anonymity years ago, and everybody doesn't have to do this, and I'm not asking for that. But for me, I needed people that would tell me that they survived, because that's how I learn. Sometimes experiential learning takes different faces. I needed to touch someone that could actually tell me they'd been through a 12-step meeting, or they'd been through treatment, or they'd been to prison and they got out of prison and they got their lives together. They were part of a unique reentry system, or they've been in a hospital and they survived cancer, or they survived, any of these other things. But our commissioner, deputy commissioner, and Commissioner then Varney knew that during the rise of the opioid epidemic, and combating addiction, that we needed to leverage a unique community that had already been there, that had been there longer than any institution that any one of us had ever worked for. And I say this to everyone: no matter where you work at, those churches and those faith-based groups, those mosques, those synagogues, they've been here longer than you have. And when we pass away, they're still going to be here. So it would be very smart of us to provide them with resources so they can become machines in their community to drive messages home. And if for nothing else, they don't have to provide outreach, they can do in-reach, and just for that portion of the population. And that would be amazing. But the department created the first director of faith-based initiatives, and that was me. I think we were the first department in our state government that did that. And my sole responsibility was to reach out to faith communities, local congregations, and engage them in a discussion of what it meant to support the addiction community, to become recovery friendly. The vision was to partner with and leverage our faith communities to increase outreach on our end as well as on their end. We had an abundance of resources in state government, not just our department, labor, agriculture, education, all of these wonderful resources. We wanted to make sure that we built a pathway with a bridge of communication with our faith community and say, hey, listen, these resources are for everyone, not just one group, they're for everyone. Any way we can better the community, let's better the community. Build recovery pathways and provide an educated, welcoming, and supportive place for individuals struggling with substance abuse issues so that they may find help and hope on their pathway to recovery. Imagine, in our state of Tennessee, we have about 12,000 different faith and religious institutions. Imagine if all 12,000 of them were shared the same consistent message around an evidence-based model with the addicted mind, the addicted brain. And we started to look, imagine that. Our goal, and my goal specifically, is I want to touch every single denomination, every single belief system, and give them the tools so they can simply have another idea or another definition of addiction. Not to contradict anything they do, rather to give them another viewpoint and more resources to be able to address people in their community. Our mission, at the time, we had a little bit over 11,500, but our mission was to educate all of the 11,500 faith-based communities about the brain science of addiction, explain how the brain chemistry changes through drug use, and resources available to help and certify each congregation to become a recovery congregation. That's a model that we've developed in Tennessee, and there's going to be some movement going forward on a national level to really push the idea of congregations working closer with state governments and hospitals and nonprofits that are not faith-based. So Tennessee, and struggling with addiction could find sanctuary within the faith community as a welcoming place to pursue recovery. Now, when I say welcoming place to pursue recovery, let me throw something at you. Most places are welcoming, but sometimes people are not trauma informed. And they don't understand that sometimes how you talk to people or how you view people is how you treat them, whether you want to or not. So sometimes a bad baseline of definitions can make a place not so welcoming, and it's not necessarily intentional, but nobody wants to walk into any place and somebody says, oh my God, there's the former junkie. I am so glad you're doing well right now. And that person that they call that is not going to come back into them. They're not going to come back. Who wants to be called something like that? When a person has cancer and it's in remission, the first thing you don't do is you walk up to them and say, what up, leukemia? I'm so glad you made it out of this. What up? What up? Whatever. You don't do that. You give people space and you don't label them. You allow them to be who they are. Somebody that's healed, recovered, remission, whatever they've done, transition from one lifestyle to another, whatever they call it. It's not my place to call it. It's whatever they call it. So how we got there, we assessed, mapped out community needs. We gathered and assessed data and ensured that our efforts were appropriate and targeted the needs of the community. So we worked with our community anti-drug coalitions and our established recovery courts and treatment courts to get the information out about partnering with the faith community so we could pull a needs assessments in the community. Off of those needs assessments, we started to work to build capacity and mobilize resources at the local level to address the needs in step one. Again, building the capacity wasn't just going to the local church, synagogue, or mosque. That's not it. You need to work with the schools, the EMTs, the fire department, local health educators, all kinds of different communities, the kickball leagues, the grocery store, the people who put billboards up. Everybody's got to get on board, because to take a targeted strategic approach, we need everybody to be involved that can or will be involved. Develop the plan to prioritize the needs identified in step one. We understood that one of the key pieces is the planning piece, because you have all of these wonderful institutions that do all of their own wonderful things. So we had to figure out, in building capacity, how to plan for them to all work together and how them to work with us. And without us also coming off as somebody not trying to tell you what to do, but rather somebody partnering with you. Implemented a strategic plan and then evaluate that data. And part of our evaluation product has been how many recovery congregations we have, how many people have been to treatment, how many people have attended a faith-based or evidence-based presentation inside of a faith community. So the impact, this is just some numbers from Tennessee in 2019. The impact of suicide and substance abuse in Tennessee in 2019, we had over 1,800 overdose deaths and over 1,100 suicides. 1,090 babies were born with opioid dependence in 2019. This is why we had to have a paradigm shift with that needs assessment, with that planning, how we got here. Those numbers are why we had to reach out to our faith community. We partner with our faith community to effectively reimagine the conversation around recovery. Now, I say effectively reimagine. Some people have the idea that when a person is incarcerated for 24, 48 to 72 hours, that's enough to get them to be in recovery. We know as professional occupationers, that practitioners, that's just the start of a person being clean for 3 days. We need about, 87, 88 more days connected to community for them to actually begin the healing process in their brain to start this thing. It can take anywhere from 2 to 5 years for a person to actively engage and fully get the full wielding benefits of a clean and free mind. But we wanted to leverage our faith communities and to increase the capacity for care. Talking about the addicted brain and explaining the concept of caring for someone who might not get it right the first time or the second time or the third time. As a matter of fact, let me ask you something. And everybody, you don't have to raise your hand, you don't have to comment, but you're going to feel me on this. How many of you have had a hurt, a habit, or a hang-up that you needed help from, and you couldn't just get it right the first time? Couldn't get it right the second time. And you couldn't get it right the third time. We can look at things like eating disorders, gambling, speeding, all of these things that are not healthy and conducive to wellness and well-being, and that can affect your mental health. This is exactly what we're talking about. Explaining to people what things do to the brain, how long it takes for the brain to heal, what a person can do, where we can attach to a person in their process, and how we can help them. We have, again, close to 12,000 congregations, over 3.5 million people attend the pews of our sanctuaries in Tennessee every Sunday. So you do the math. We talked about how many people died of an overdose, how many people died of suicide. There were 2,500 people of faith per one person who lost their life to suicide or overdose. 2,500 to 1. Guys, it took one lady, one time, 2 sentences to put me in a car, get me to a meeting, and I'm here today. Of course, everybody's process is not going to be like mine, but what if somebody else's is? What if somebody else, that one opportunity that we had to give a person right now, we can't physically hug, but we can sure give a distance fist bump, love somebody, meet them where they're at, and try to get them to the resources they need. Or better yet, become the resource ourselves. So what are the goals of our faith-based initiative? All of the stuff that we're talking about, we're trying to center it all in and pull in the faith community together. So our goals are to connect individuals struggling with addiction to treatment straight up. How can the faith communities be an access point to get a person into some type of supportive service? Not just treatment, housing, mental health services, other types of clinical services, medicated assisted treatment, education, food, clothing, transportation, all of these wonderful things. Facilitating an understanding of what treatment and recovery are. Did you know that in some of our faith traditions, the word treatment means something entirely different than it does from an evidence-based perspective? It doesn't mean that it doesn't mean treatment in either one of the communities. What it means is let's pull our collective resources and definitions together and figure out how we can serve the person. Every time we do it this way, the person falls in between us. Every time we do it this way, we can catch the person and they don't have to fall between us. We can settle our disputes off of terminology later. When a person is broken and they need help, we don't have forever, we have right then. Okay, fair enough. So understanding the difference between treatment and recovery and how it relates to our communities and also how it relates to an evidence-based model. Increase knowledge about addiction. Addiction is a treatable disease. Uh, Everybody doesn't look at it that way. I do. I look at it from an evidence-based perspective. I look at it from a health perspective. We can treat things that happen to people if we do things in a proper manner. Also, give people tools so they can address it themselves. Understand the continuum of care and collaborate with it. Prevention, treatment, recovery, criminal justice. That's the continuum. Faith-based, 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 faith-based. Of all of the continuum, they intersect, but the faith community actually intersects through every single one of them. Faith in prevention, faith in treatment, faith in recovery, faith in criminal justice. Congregations and clergy and volunteers can attach to a person from the first day they find out they're using drugs or alcohol, or they've been arrested, or something has happened in their life, and they can walk with them from the very beginning through the very end, even if they only catch them at the very end, which might be criminal justice, but they can still catch them at the criminal justice phase and walk them right back out to the prevention side and eventually to the recovery side. But that's where the faith community is powerful. Help groups understand our best practice model and promote and continuously improve the effectiveness of our faith-based initiative. So we have 3 faith-based coordinators, and their job is to go out and to recruit congregations and organizations to be part of this unique puzzle. They're all people that have lived experience. We wear these badges. They're a certified peer recovery specialist. We're not. We've given up our anonymity to tell people our stories, while hopefully using our stories to help pull people toward a recovery walk, or to help people develop their own plan, or to help people realize that they're not alone, or just to be a light in the darkness for so many people that didn't realize that there were other people like them. But they're a group of individuals with lived experience responsible for recruiting, training, and recognizing congregations. And here's our 3 faith-based coordinators. There are their contact informations. So if you're in Tennessee, or if you've got somebody in your family, or you know clergy in Tennessee that's not working with us, each one of those faith-based coordinators can provide a unique resource for them. And I'm going to share some of those resources in a few minutes, but our faith-based coordinators will go to any faith institution, any belief. It doesn't even have to be a faith-based group. We will go in and provide different trainings free of charge to help them become recovery friendly, to become trauma informed, to understand person first language, to understand that, to be a resource, you don't have to have a program. You just have to have an open heart and an open mind. And maybe you can learn what other programs are available and figure out how to walk somebody to the front door. Here's their contact information. I'll give you a second if you want to screenshot that. You can also go down to the bottom of the page, and there's a link. And that link, you can go to it, and it'll give you all the information on our faith-based initiative. We got a data dashboard and some other things that we can share. The results, we have 746 certified recovery congregations. We provided educational forums in every one of Tennessee's 95 counties. We've increased the awareness of recovery support resources nationwide. Can you imagine how cool it is to get a call from clergy from the pulpit on a Sunday afternoon that says we have a person that needs to go to treatment? Y'all, that is amazing, because that's a partnership. That is a unique partnership. That's also recognizing that we benefit from working and serving people together. We are a resource for you. Even if you're not in the state of Tennessee, please reach out to our coordinators and our team. I'm going to go over some other pieces of our team as well. But we're here as a resource to show people, like, this is what we've done. We're not talking about hypotheticals or theoreticals right now. We've actually done this work, and we're doing this work, and we're going to continue to do this work. And if there's anything we can do to help any one of our states in Region 4 or anybody else abroad, please reach out. So what do our faith-based coordinators offer? Free training opportunities to empower and equip ministries, connection to recovery resources and other recovery supports, opportunities to collaborate with other faith-based groups. That is the biggest piece, is because sometimes our clergy need to see an example in their community. Just like I needed to see an example of another person that had survived addiction, that had survived, life's, unending struggles. I needed that close, personal, intimate contact with someone. A lot of our clergy it's of value to them to meet other faith-based organizations, other Celebrate Recovery meetings, other AA, NA recovery meetings, MARA, Medicated Assisted Recovery Anonymous meetings, connecting with them to see how they do stuff. It's not about them working with us in state government. It's about tools to serve your community. The initiative is about saving communities, saving people. It's got nothing to do with anything on the top end or the bottom end. It's about the people that you can see every day. Recognition as a certified recovery congregation, that will definitely impact ministries, because we tell people in other counties, our coordinators, people call us all the time and say, hey, listen, I'm in this county or I'm in this state. I'm looking for a faith-based recovery meeting. Do you have one? We can just pull out a list of congregations or groups, or we can call clergy directly and say, hey, we've got a person that's traveling. Is there an opportunity? Or do you guys have a meeting tonight? Again, that's just an opportunity and a resource for other people. So some of the training opportunities we provide with Project Lifeline, which I will discuss in a minute, are suicide prevention, QPR. We do this also in coordination with TATTC, Tennessee Association of Drug, Alcohol, and Other Services. That's where Maria Smith, my partner, is on here. It's a 1 to 2 hour basic training for suicide prevention, covering how to ask someone if they're thinking about suicide and how to persuade, not to offer advice, but to persuade them to seek appropriate help. So when you talk about seeking appropriate help, if you're a recovery-friendly congregation and you have resources, you actually know of resources that can be appropriate, that can help people. So that's part of the recovery-friendly process. If for nothing else, the congregation with 3 people might have a Rolodex or a Facebook page or whatever, full of resources where they know to reach out and help someone find help. Assist. It's a more intensive workshop around suicide prevention, but it talks about how to implement a suicide intervention with individuals who are having thoughts of suicide and try to keep the individual safe for now, and then reach out to resources and try to get them there, get them to you, get them to that person. Having the functional understanding of what a therapist does, what a counselor does, what a mental health co-op is, understanding that there are mental health institutes across your state, across your territory, understanding there are people like my friend Melvin Smith that works primarily in substance abuse, but has his bead all over the mental health community as well, because we know that co-occurring substance abuse mental health disorders are prevalent and they are real. ACEs, adverse childhood experiences, and trauma-informed care. Our trauma-informed care for our faith communities has been one of the most magnificent things we could have ever done. Talking about ACEs and being trauma-informed to a faith community who has been operational in their community, again, for hundreds of years, has just another eye-opening experience for both communities. It can be a 1 hour introduction or an in-depth 5 hour training covering the effects of trauma and the need to build resilience in children and adults alike. Becoming trauma-informed will give you the opportunity to not traumatize someone. Let me say that again. Becoming trauma-informed will give you the opportunity to not traumatize someone again. Sometimes in our altruistic zeal and goodness as a person, we may mention things to a person about their past that they're trying to move away from. And when we mention those things, we may trigger something in that person's past that might cause them to relapse. And becoming trauma-informed, we can start to understand, a deeper knowledge of what's happened with individuals. So it's not, hey, you're a bad person. We understand that something may have happened in your life, and we want to make sure that we're not going to do something to remind you of that. We're going to help you move forward. The training focuses on the importance of community and connection, as well as it helps organizations and congregations create a safe place for healing conversations to begin. Healing conversations do not start with you telling somebody that you remember when they used to be a drug addict. That's not a healing conversation. A healing conversation might be asking somebody how they're doing today or giving somebody a hug. That's a great healing. That's a great healing process to extend an olive branch, not throw a rock. Building strong brains, a 1 to 3 hour training that aids in building a knowledge around early childhood brain development. Again, this all goes into play with ACEs and with QPR. The training helps individuals see how ACEs negatively impact the architecture of developing brain, but how a safe, stable, and nurturing environment can help a child to thrive. James, I don't know if we talked about this, but early on when the ACEs studies came out of building strong brains, we did a rudimentary question ask with a group of clergy in deep East Tennessee. And we asked them 10 questions. We said, here are 10 questions. We're going to ask you these 10 questions. These 10 questions can give you an idea of things that may have happened things that you've done in your life later, but they could have started when you were 5, 6, 7, 8 years old, maybe 2 or 3. So we asked them 10 questions. The facial expressions and the body language that we saw when we looked around, when they answered the questions about sexual trauma, about abuse, about not knowing where your next meal was coming from. All of these questions. And one of the biggest comments we had was one of our clergy, who was a really good friend of mine. He said, I'm sorry. He said, I'm sorry. I said, well, what's wrong? He said, I had no idea. He said, I've scored almost perfect on this thing. He said, and now I see the correlates in my life. He said, what have I missed in my sanctuary with the people that look up to me for leadership? And see, that vulnerability moment with him was an opportunity for us to partner with him to provide whatever trainings or resources he needed in his ministry capacity. It had nothing to do with a religious perspective or a belief perspective. It had to do with his leadership perspective. Now he understood that this is a resource that I can use to serve in my church, in my congregation, in my Sunday school. This is an opportunity. Building strong brains. When we start talking about adolescents and youth, Sunday school teachers, when you can hear and see me right now, you have children at their very youngest age with a very, very, very vulnerable and learning brain. So guys, we need to go to Sunday school probably till we're 25 because our brain doesn't mature to then anyway. So I just want to throw that out there to the fellas on here that can hear me right now. Mental health first aid, adult, youth, or public safety. 8-hour training participants go through the overview of common mental health disorders and provides help a person to develop understand how a person developing a mental health problem or experiencing a mental health crisis can get resources or how you can be a resource for that person. The training explains how to give appropriate first aid until proper treatment and support are received or until the crisis resolves. Again, understanding the resources in your community makes mental health first aid make sense. Mental health first aid would not make sense in a congregation if you didn't know any community-based resources to call in the process of giving mental health CPR. So when you're starting to revive a person and bring them back, somebody's got to be on the phone. Somebody's got to be on the phone, or somebody's got to be text messaging, or somebody's got to call a hotline in the process of helping a person stay alive, to stay there with you. You be present with them at the same time you're reaching the resources to get that person a resource. But you can't do that if you're not in the know. When we talk about addiction and mental health, it's not we're in the age of information. We do not have time to play a guessing game when every bit of information that we need is right here. Every single bit of the information that we need is right here. Other training opportunity, addicted brain, 1 to 2 hour presentation spreading on how addiction affects the brain. Again, how long it takes for a person to become dependent when addiction sets in, and how long it takes for a person for 7 to 14 days of legally prescribed opioids for that brain to hit a control-alt-delete. It's not as simple as 24, 48, and 96 hours in jail. It doesn't work like that. Some people, absolutely, the shock incarceration is what it needs. But for a lot of Americans, for a lot of other people, when they go into a criminal justice setting, it only intensifies cravings. So when they get out of the jail setting, they go right back to the playground and playmates that they just got away from. And that's where our faith community has to be involved. I'm going to give you an absolute. I don't like using absolutes, but if you're going to be part of the program and you want to do this, become a certified recovery congregation. Know what type of information is available for you and your community. And when a person walks out of jail, there can be ways you can have your resource portfolio out there for them. Well, we have AA, NA, Celebrate Recovery. We have a mental health ministry. We do mental health first aid. We have food. We have clothes. We have deodorant if you need it. Sometimes people run back to where they came from, not because they want to use, because they have nowhere else to go. They have nowhere else to go. And that's the God honest truth. Sexual addiction and compulsion in the church. We got a 1 to 2 hour training that assists congregation in understanding sexual addiction and compulsion. We provide a 3-day training on support group facilitation that allows the congregations to effectively provide support groups to individuals with SUD, substance use disorder, or affected by other life controlling issues. So how do you become a certified recovery congregation? The coolest, most easiest thing in the world is, first, let's be friends. Let's talk. Let's figure out where you are and let's meet each other where we're at. Provide spiritual and pastoral support according to the congregation's culture. Again, without leadership support, most ministries won't work in an institution. I'm just going to be honest with you. If you're clergy, please talk to the people that you put in charge of these ministries to make sure that the ministry is going to be supported from the top down. When the ministry is supported from the top down, it gives the congregation a unique opportunity to buy into the ministry, whatever it is. So even if they don't necessarily understand it, if leadership says this is something that we need to do to help serve our community, they're more prone to listen to leadership from that institution than leadership from my institution. Got it? Make perfect sense? I work in state government. I'm not going to go up into the pews of your sanctuary, get up behind the pulpit and tell you what you need to do around mental health. But your pastor can, your imam can, your rabbi can, your priestess can, your priest can, your leader can. And then I can be right there to back them up. View addiction by its definition as a treatable disease, thereby providing hope to those who need treatment. Treatable disease, not something to throw rocks at, something to understand, and something that we can transition through. Embrace and support people in recovery and walk with them on their journey. Fellowship with people. Some of the strongest recovery advocates in the world don't have a degree in anything. They don't have a PhD. They don't have an MD. They don't have a PsyD. They have love. They have love. They understand that they've been through something, or somebody else in the family's been through something, or they have empathy and try to be in the shoes, walk in the shoes as another person. So embracing and supporting people is powerful. We did an initiative many years ago before I worked in the state, but it was when I worked in the community, where we brought in a group of grandmothers to talk to a group of guys that had been, pretty lengthy criminal records. And, man, sometimes the criminal history does not adequately describe the person. It describes some things that have happened in the person's life, but it's not always. Sometimes when you see a person that's been arrested 65 times and they've never had a mental health diagnosis or a mental health assessment, we begin to wonder where we may have dropped the ball somewhere. Just curiosity. So we brought a group of ladies in. I was an MRT instructor, moral recognition therapy. That's a cognitive behavioral therapy module that can be taught. It's got 12 sessions. If you want to look that up or you want to email me about it, I'll send you the information on it. But they came in, and these ladies came in, and they were all seasoned. I call them seasoned, man. These ladies they had it going on. They were all retired grandmothers. They wore these big old hats. And the minute they walked in and talked to the guys that were in this program, as a reentry program, from the minute they started talking to these guys started opening up and telling these group of ladies things that they never told me as their group facilitator. They never told me this stuff. And the ladies just started asking them questions and speaking to a lot of these guys as a resource that they've never had. And sometimes that resource was a motherly resource, grandmotherly resource, or somebody that gave them the idea of what unconditional love might actually feel like. That was an awesome experience. These ladies were all part of some of the faith communities that were around that area. There's power in the pews of our sanctuaries to do this type of work. Sometimes the initiatives and the ministries don't have to have a name. They just have to have people that are willing to work. Disseminate recovery information that our department will provide, and host or refer individuals to recovery support groups. You don't have to have a recovery support meeting to be recovery friendly, but it would be great if you knew all of the other meetings that were in your community, including who the treatment agencies are, who the mental health agencies are, who ATTC is, and what trainings they can provide for your community. What is SAMHSA? Oh, wow, there's information on SAMHSA. There are funding opportunities. What are these conferences that people are going to, listening to other clergy from diverse backgrounds? This is how you build your social capital that can become your recovery capital in your community, is by understanding that you don't have to have anything to refer people to everything. I am not a medical doctor, but I know a whole bunch of them. So when a person comes to me and they need to go see a medical doctor, I can point them that way because I know who the medical doctors are. There are two ways to become a certified recovery congregation. Our coordinators in the region will become aware of your service to the community and choose to recognize you, or you can fill out this survey. There's a QR scan here. If you have an Apple phone, just hold your phone up and a box will pop up. When that box pops up, it'll take you to a link that will come to me and my team. You can fill out the information, or if you have an Android phone, you may have to get somebody with an Apple phone to send you the link. That's my Apple joke. I'm an Apple person. I've got one of each. But get the link. Open the app on your Android. Pop the link up. When you get that link, you can fill out the QR scan. You can fill out the codes. I'll fill out the information and it'll come to us. Lifeline Peer Project is the last piece of this puzzle. The Lifeline Peer Project works hand in hand with our 3 faith-based coordinators. Our Lifeline Peer Project was established to reduce the stigma related to the disease of addiction and increase community support for policies that provide for treatment and recovery services. We have a couple of Lifeliners on here now. One of those Lifeliners is Nathan Payne. He represents our Region 3, which is the Upper Cumberland Plateau. Nathan and myself, I was one of the original Lifeliners. This is how I came to work in state government, was I was with the Lifeline Peer Project, which is funded by our department. And I was out standing on soapboxes, giving testimonies to people that may or may not have wanted to hear it, but I told them anyway, because even though they might not have been listening, the child might have been listening, or the mother might have been listening, or the brother might have been listening. But the project's approaches include establishment of evidence-based addiction and recovery programs. We got a group of people that are in recovery that are running around in the community talking about the other side of addiction. This is what recovery looks like. This is what community looks like. They provide educational presentations for civic groups, faith-based organizations, and community leaders to increase the understanding of the disease of addiction and support for recovery strategies. Again, Lifeliners are not just, they don't just work with the faith community, but they work very closely with the faith community through the faith-based coordinators and on their own. Lifeliners are all certified peer recovery specialists. There's a link at the bottom to our certified peer recovery specialist. My good friend, Lisa Reagan, who is in our department. This is Lisa's division of the department. Lisa and Michelle Webster, who are really good friends of mine. I've been a certified peer recovery specialist for 7 years. It's one of the coolest things, almost 8 years. It's one of the most honorable things that I could have ever done, is be able to go through a training with other people in recovery and listen to how we serve communities also differently, but also the same. People that are certified peer recoveries help others on a path to recovery from mental illness or substance abuse, and or have firsthand experience with mental illness and or substance abuse, and can offer support and understanding. Have at least 2 years of active recovery, at least 2 years. We want people to, obviously, to be certified peer recovery specialists, we want the person to have some distance and some time away from their addictions, and also have been able to build that resiliency. Use their personal recovery story to help others and promote self-determination, personal responsibility, and empowerment. Certified peer recovery specialists, imagine if we had one of them in each one of our congregations as the point person to be in our certified recovery congregations. Provide referrals and recovery resources for individuals with SUDs and mental health issues. They can be active in congregations. They can train others in their congregation to help, and they can help congregations understand the reality of mental health and addiction and provide support to those in need. Listen, guys, social media likes to give us its own baselines of addiction and mental health. Social media is somebody else's opinion. It is. And sometimes social media gets so far out in front of who we are as human beings and how we serve and view our neighbor that it's become such a detriment on our connections to the people that we're trying to help. Understand, there is a reality of a mental health diagnosis. There's a reality of substance use disorder and a substance use disorder diagnosis. The reality is you can't just sit there and call people names and expect them to get better. Yeah, it might work for somebody. But what it normally does is make a person tell you they're okay when they're really not. They'll just tell you, I'm fine, I'm not using, I'm great, I'm just good. I just don't want you to call me those names anymore. I don't want you to beat me up with your words anymore. So we want a certified peer recovery specialist or person with that experience to be active and closely work with congregations across the state. So connection to other community resources. These are the connections that we resource across the community, across the state. Community prevention coalitions, formerly known as anti-drug coalitions. I stay away from the name anti-drug because sometimes in the community, people that don't understand the concept of an anti-drug coalition associate anti-drug with criminality. Just a word shift. Prevention coalitions. Treatment and recovery courts, formerly known as drug courts. Addiction recovery programs, ARP agencies, which my friend Melvin Smith, he oversees and facilitates that program. These are programs that are state funded, that partner with the state and other local entities to provide recovery support resources. Local health departments and councils, health educators, law enforcement agencies. A lot of our law enforcement, our LEOs in the community, if they knew where meetings were and resources were, they're the first initial contact with a lot of things that go on in the community. And when they have access to resources, they can become a more powerful resource in the community. Nonprofit organizations, and lastly, colleges and universities. Every college and university benefits from a faith-based initiative that functions and operates great in the community, because just about every college in our state is surrounded by churches, synagogues, and mosques. So having that partnership to understand that the colleges and universities benefit from an AA meeting or an NA meeting or a Celebrate Recovery meeting or a food pantry, all inside of our congregations, that's recovery friendly, and that's partnership. We just recently started at Lipscomb University. Nathan Payne, who is on here, and Jamie Harper, our faith-based coordinator from Middle Tennessee, just partnered with Lipscomb University to create a recovery safe space, and we call it Bison Recovery. Lipscomb is a very, very uniquely old and seasoned conservative college. It's a Christian college. Man, these guys have built something, a prototype and a model of what a recovery space is going to look like going forward. And this is a model that can be used all across the country. There are 17 lifeliners, each one located. This is not all of them. This is just a piece of the group. I got to put the bearded guys in here because they show you that cultural competency is pretty cool. We got guys up in the mountains and we got guys in the cities, girls in the cities. 17 lifeliners. They're all housed in prevention coalitions. We provided over 6,100 recovery trainings, and we've referred over 14,000 people to treatment and recovery services. And most of this is happening from the pews of our sanctuaries or in partnerships with our faith community. We've also started over 660 new recovery meetings, and the majority of those have been in connection or in the pews of sanctuaries. Here's a map of our lifeliners. If you need a screenshot of that map, there it is. If you need this PowerPoint, I'll be glad to send it to anyone. If they need these resources, you can have all of my information. This is public information for you to have. But these are the contact information for our lifeliners. They serve the whole state, every single county. I have had the pleasure of myself of setting foot in every county in Tennessee and breaking bread with our faith community in every single county in the course of the almost 8 years that I've been here. Maria and Melvin can attest. They've traveled with me in a lot of these areas. You know, we may look a little different, we may speak a little different, but we're fighting the same issues. And the quicker we get on the same page, the more powerful we'll be as a community. Here's the connection. Our faith-based coordinators recruit and build relationships with our congregations willing to help guide their members and community to recovery. Our Project Lifeliner connects people with treatment and recovery support resources and serves as a single point of contact for recovery congregations seeking to establish support meetings and help others find treatment. Our Lifeliners will go in after our faith-based coordinators connect. They will go in and help build the group facilitation, put those pieces together. The Tennessee Recovery Navigators, who we did not discuss today, but they're also another piece of this puzzle. They're all in long-term recovery, and their job is to be bedside when a person overdoses in a hospital. And the first question they ask is, what are you going to do now? What's next? We have access to resources. They work with Project Lifeline to identify community-based resources, including, but not limited to, recovery congregations, and are stationed in emergency departments and help those who have experienced overdose or drug-related industry. And lastly, our ROPEs, our regional overdose prevention specialists. They train people to administer naloxone and to prevent overdose deaths. We have got story after story that I could share with you of training, naloxone trainings we've done in churches in southern rural Tennessee, where the family members have reached out and called us and said, thank you so much for the training. I found my daughter, my son, my neighbor asleep with a needle in their arm or passed out in the car. They've overdosed, and we were able to administer naloxone and then call an ambulance. This has happened over and over and over and over and over again. And all of these initiatives that we use, these people are in long-term recovery and or have lived experience. Here's a campaign. These are three of my guys. This is Will Taylor to the left, Jamie Harper in the middle, and Kobe Lane to the right. And this is in one of our rural counties. They did an initiative, End Overdose. Hear no evil, see no evil, speak no evil. We want to make sure that people know that all these guys are in long-term recovery. All of these guys are community advocates. And when I tell you all these guys are loud, they're loud. They also have big beards now. This picture's old. They also all have COVID beards that they've gained during the COVID-19 pandemic. So right now I'm going to open the floor to questions, and I'm going to close my PowerPoint. And I want to say thank you to everyone that listened to me today. I hope I did not bore you. And if I did, I'm sorry, but you know you needed the information, so you're going to share it with somebody. So with that, I'm going to open up the questions. And James, I guess you can guide it from here.
Yeah, if you don't mind, I know sometimes there's a little bit of a lag, so if folks don't mind putting those in the chat box, we definitely wanted to provide an opportunity for folks to ask Dr. Burks and some of his team that may be on questions regarding what initiatives may look like related to faith community and addiction and recovery, or related to what getting services in your own state may look like as well.
I got a bunch of questions in there.
I do see the question of whether or not there is a similar initiative in Kentucky specifically, but I wonder if you could also maybe speak a little bit about that in adjacent states or by region or other states you may have been able to help with.
Absolutely. So I've worked with a group out of Kentucky through Adam Trosfer, who is a partner with James and mine. Adam has worked with us with ATTC. I've met him on numerous occasions. He and I have talked to clergy and leadership in Kentucky. So Kentucky is developing a faith-based initiative. And actually, so before COVID, I was actually working with Kentucky through a different system to help them build a faith-based initiative similar to Tennessee's. And during COVID, everything kind of took a back step. But moving forward, Kentucky does have a group, and they are developing through the SOCAT initiative, Systems to Carry Across, something similar to our SOCAT Tennessee. Kentucky has a SOCAT, Systems Carry Across the state. I forgot the acronym, but they have a faith-based initiative that's very similar, and they're working on this project. And also Adam is helping with other clergy develop an initiative similar to this. I think Adam, James, and myself will be developing something soon as a co-partnership with ATTC to do that in Kentucky. So Sherry, I see you, Sherry. Okay, I see you over there now. Hi, Sherry. Um, I see you. I would love to talk to you offline, and so I can connect the dot with you. I'll give you the email addresses. You can connect with James or myself, and I'll give you the information of the people that are putting their heads together. I'll tell you one thing you need, what they need. They need you. If you're in the community and you're willing to be part of building a faith-based initiative and you have experience understanding evidence-based practices and you know all of this stuff that we talked about today, you become the resource for the other clergy across the state that don't know this. Because we have a lot of clergy that are bivocational, trivocational. They have a lawn care business. They're mechanics. They have all of these other things they do. And then here you are, the recovery advocate that could go in and lay the groundwork for the ministry to build. And so that's kind of the power that you could, the powerful role that you could have in the community. So I'm thankful for you asking that. And I hope to hear from you. Where are you at in Kentucky?
I'm in Lexington.
Okay, good. Good for you.
And
Good for you.
I see Marche Burton on here. She's from Louisville. Marche and I can take off. I know Marche really well.
Well, I would love to have an email that's got Marche CC'd in it. And girl, let's do this thing.
Yes.
You better believe it. I look forward to it. Thank you. I'll probably loop in some of the partners that we have so I can give you baseline definitions, but I'm going to reach out to Adam as well to make sure that he knows who you guys are. And then I'm talking to someone in his area because he's got a wealth of resources and things that he's building. Many years ago, Kentucky used to have a faith and prevention conference, and a lot of people didn't know that. They used to meet in Shepherdsville, Kentucky. I actually drove up maybe 8 or 9 years ago to one of the conferences, and it was the most amazing thing I'd ever seen. It wasn't faith and treatment, faith and recovery. It was faith and prevention. And that's actually where I met Adam way before. I think it was like 9 years ago. He and I both, I didn't have the beard. My beard was black and my hair was black. I didn't have gray hair, so I was a lot more agile and able to work with him. I make that joke with him all the time. We've grown so much. But that is there. And thank you, Sherry. I'll talk back with you soon. Any initiative in South Carolina? I can answer that, James, if that's okay.
Yeah, please do.
So Melissa, I'm working with Behavioral Health South Carolina. I'll actually be there in 2 weeks at the state conference to talk about developing a faith-based initiative. We're going to provide 2 workshops in South Carolina. I'm going to one of my lifeliners and one of my faith-based coordinators are going to go with me, and we're going to spend 3 days there at this conference. And I would love to share that information with you. I think it's BHSAC, Behavioral Health South. I forgot the acronym. I'm bad with acronyms today. But I'll send it to James so he can send that information out to everyone. But that's going to be the building blocks of the faith-based initiative for South Carolina. It's going to start there. This is the partnership between community advocates and state government to do this. So I'm excited about that opportunity. So you asked the right question at actually the right time. So I would love to, if you can email me and I'll email back and forth with you and James, and we'll make that happen. Georgia, Kenneth, you should talk to James. You are in Georgia. James is actually located in Georgia with ATTC. And ATTC's got a few projects that they have off the ground of building faith-based initiatives. And I'll let James drive into that question a little deeper. But Kenneth, I'm going to be happy to work with you because I'm going to be working with James. So we're all on the same page. We're all on the same team. And my Tennessee Vols are going to beat the Georgia Bulldogs this year. I just want you guys know that. That might not be true, but I said it. I said that.
I remember a verse about faith without works. Nah, I'll leave that alone.
Faith without works. Whoa, look, who just dropped the mic on me? Melvin dropped the mic on me. Melvin knows I'm a UT fan. I've struggled, James, these last few years, but it's all right. I'm still here.
I will say too, I will speak a little bit at the very end regarding a couple of initiatives that are across the region, again, across the Southeast. I specifically am in South Carolina, North Carolina, Tennessee, and Kentucky. And so if it's related to one of those 4 states, I'm more than happy to be point on that. Or if it's one of the others, I can get you to the right person to have that conversation as well. So definitely want to be a resource in as much as I can be.
Thank you, guys. I have no other questions. Hi, Marcia. Go Vols. I see y'all in there. Listen, I want to say that I'm thankful for you guys. The faith community was my entry point to get into treatment and to get myself back together. I'm currently I currently facilitate a men's group at my church. I volunteer at church. I volunteer at other churches. I spend time at our local synagogue with our Islamic community, a local mosque with our Islamic community. I work with the Jewish community. I have had the unique blessing to be able to meet other people, express my faith, and let people know that this is what recovery looks like. Recovery is not an isolated community event. It's a big strategic ball of stuff that needs to continue to grow, because the minute we ignore or disregard or act like it doesn't exist, addiction, that's when it takes our children. That's when it takes our loved ones and our parents. We're in a place right now that post COVID is about to come. People are about to start connecting and hanging out and all kinds of other stuff. So it'll do us some good to go ahead and partner to start building and developing supports in the community just in case we need them, just in case people need them. I thank you all. I look forward to continuing to present and to connect with you guys. And you guys are awesome. I hope it's sunny where you are and you can enjoy this day. Thank you.
Thank you so much, Dr. Burks. We definitely do appreciate it. As a reminder, I'm putting the link for the evaluation that we ask you to take. It really is short and sweet. It's pretty painless. So by all means, please do take a moment to fill that out. It's literally like 10 questions, probably 2 minutes or so. Also, connecting with faith communities is ongoing. That's something that we're all doing in a consistent way, and it's something that's really at the heart of a lot of the work I have the opportunity to do at Southeast Addiction Technology Transfer Center. If you want to find out more about that, probably the quickest, easiest way, rather than trying to quote a URL to you, is just to say, if you put in SATTC or Southeast Addiction Technology Transfer Center, if you Google it, it'll pop up. It's usually in the top 1 or 2. If you click on that and click on Let's Have the Conversation, that will take you to all of our faith-based initiatives. We do have quite a number of those that are in the works and are coming along. A couple of those have involved several listening sessions between the faith and recovery communities. We actually have a model that is a faith and recovery community collaboration model that's a very deliberate way of trying to connect individuals to resources within both communities to actually help both communities work more effectively together. We also have the annual Interfaith Institute on Recovery, the AIR conference that's coming up in July. That's the 14th through the 16th. If you haven't saved that date, I really encourage you to. That's a phenomenal conference. Dr. Burks will be presenting there as well. So we're really excited about that and having him back there in addition. There are other initiatives and other resources that are there that I'll just mention in passing. Some of those are, there's some really great articles that have been written about spirituality and recovery and faith and recovery that are great resources, particularly if you are somebody who's interested in pursuing grants. It's good to have the research piece of that sort of already laid out in a succinct way that's easy to draw from. That can be a phenomenal asset as well. Ms. Lee was gracious enough to put the link for the AIR conference in the chat. I really appreciate that in addition. But essentially, we're trying to do exactly what Monty, or Dr. Burks, is talking about today, to really come alongside the faith communities and help equip them to better serve the people who they're already there serving in many cases, and to both in reach to those who are part of their congregation or part of their synagogues, part of their mosques, and to really outreach to the communities that we're a part of. That connectivity is really effective at chipping away at addiction. In fact, when we get in our huddles and we don't connect together, we look more like the addiction we're trying to treat than the recovery we're trying to inspire. So I really do appreciate the amazing work that Dr. Burks and the folks at Tennessee, the Lifeliners, and all of the crew are doing there, and really hope to see that take root and replicate in other places. I know Dr. Burks has been a tremendous resource to me personally, as we've looked at that in my home state and are looking at that in other places as well. And so I encourage you to reach out if you're able to do that. Reach out to Dr. Burks, reach out to myself. I'll put my information in the chat as well as far as my email. I'm always available and more than willing to be a resource if I can be as well. Any other questions? I don't want to hold the group hostage for the time remaining, but I also don't want to cut anyone short if they do have questions as well. All right. Hearing none, I will just say thank you once again so much for your time, for being a part of this conversation. We really look forward to great things to come as we really continue to work together within the faith community and with the faith community to help individuals struggling with substance use and mental health disorders. That's what we're really about at SATTC, and that's what Dr. Burks is living out every day. Thank you so much, Dr. Burks, for taking the time to join us today, and we look forward to working with you in the future. If you would, please be sure to click the link for the evaluation that's in the chat. I just posted it again one more time. And there's some other resources that are there in the chat as well. So please do go ahead and check on those. If you click on those, once you've clicked on them, you should be free to go. You should be good to go. We're going to stay on for a couple minutes if there are any other final questions or questions someone didn't feel comfortable posing to the full group. But once you click on those links and have the resources, you're free to go. Otherwise, thank you so much for taking the time to join us today, and we hope you benefited from it. I know I did, and I look forward to working with you in the future. I see questions regarding faith-based initiatives in Florida. And actually, I've seen several, some about Mississippi, some about Florida, so various states here, there, and yon.
So Florida has a faith-based initiative through the Department of Veterans Administration, but it's not like the one that we have. If the person who is asking in Florida, I do work with a group of faith-based communities and leaders in Florida, as well as some of the other people that work in state government. I think that through the innovative partnerships with ATTC, I think you should ask us that question again in about 6 to 8 months, and give us an opportunity to re-answer that. Maybe we can have we can do another Zoom meeting, and we can talk about the progress made there. Same with Mississippi. I've talked to Mississippi and Florida on many occasions. Every state that's in Region 4, I've either been to the state or I've had a conversation with their ministerial alliances and the state government. One of the things that has hindered a lot, especially these last years, COVID, obviously, but even before COVID, more community collaborations. They need more of you to step up and say that I'm willing to work in this capacity or this space. So that's going to happen moving forward. We had a faith-based conference here about 3 years ago. James presented at it. Maria, Melvin were there. I was amazed that we had 400 clergy from all over the country, including Nevada, who now has a faith-based initiative from the conference. They've literally partnered to build a faith-based initiative in the state of Nevada. But they came, and what they're doing and what you guys can do is do the same. And we're going to help you. We'll help you in any way that we can. And I'm on ATTC's, one of the advisory committees. So I'll be waiting to hear from you guys, and I'll take leadership from James on this one, and we're ready to drive it home. So you asked, it's not there doesn't mean you can't start it. It doesn't mean you can't start it. It just means maybe you might need us to help you put some wheels behind it, and we surely will do that.
I also saw that Adam just shared his email address in the chat as well. Again, if you're in Kentucky especially, and you're interested in the faith initiatives that are happening there, by all means, please connect with him. He's a great resource within the state, and they're doing some exciting things that are coming up as well. So I'm looking forward to hearing more about those in the day to come and helping with planning those as well. So please do reach out to Adam Trosper as well. And again, his email is in the chat. The only other thing I'll just mention is that if you happen to know of clergy who are younger clergy, probably 25 and under in that ballpark, we actually have a special initiative we're beginning to work on related to younger folks who are faith leaders. And so we're trying to really get a look and get a little bit of a finger on the pulse of some differences in how the younger generation views the faith community, how they view connections with them. So if you have anybody along those lines, please share, either share their email address with me in the chat, or mine is there if you don't mind sharing mine with them. I'm just looking for a good way to connect with younger leaders and faith communities as well. So of course, we appreciate the seasoned folks as well. We're so grateful for their voices, but we want to also make sure that we're hearing the younger generation. One thing I love about being the age that I am is I'm old enough to realize that my ceiling, as high as I can reach, is the floor of the next generation. That's where they're going to start and build on it. And so I'm really excited to see those steps forward in the days to come as well.